All right, guys, hi. We're in West Hollywood, Los Angeles, California. It's Jason Emer. We're now gonna use neuromodulation or neurotoxins such as Botox, DYSPORT, and XEOMIN to just soften movement lines. This could be preventative in some patients like mine here that's younger, that's just starting to see some fine wrinkles between the eyebrows, the forehead, and around the eyes. But it also can be a diagnostic. You can use it for treatment in patients that already have wrinkles. So what this medicines do is they stop the movement. Now, we don't want that frozen look because then you never know what expressions the person's giving. So we want to do a soft, natural look. That's what we're going to do for her. The other thing too is she has beautiful open eyes, but her brows don't elevate that much. So I want to give a little corner elevation just slightly when this kicks in. And so to do that, we work on treating the glabellar area first, the lateral part of the eye, and then the forehead. When we treat the glabellar here in the frontalis, because that pushes the brow downward, what we're going to do is we're going to do this area here and this area here, because by stopping the innervation in that area, it makes this muscle work harder and it lifts this up. Then we just soften lightly in the middle. The other thing, you guys, how many of you have shorter foreheads? If you look here, she has a very short forehead, a beautiful hairline. So you don't need as much of the normal. There is no normal dosing in people. You have to customize the dosing. And someone like her, if you do the typical 8 to 16 units, it might be a little too much on that high end. So we're gonna do a very small amount to her forehead to just make it softer and look nice. So squeeze in for me, show everybody that mean face. Perfect, she's got strong muscles here. Relax a second. We're gonna grab the procerus muscle, we're gonna go right in there, inject a little bit of that Botox, and over time, for the next 2 weeks, it'll soften. Squeeze in again, we can look at the corrugators here, relax. This is a big corrugator right here, right into the belly of that. I'm gonna give a little bit of that. Again, squeeze in again, show everybody that mean look, relax a second. And she's not mean, she's really sweet. This is why we're doing the treatment. And then squeeze in again. We're gonna go, see how she has a little tail here? You see right along here, there's a little bit of the tail. Relax a second. We're just gonna go in there and just do a little teeny bit, because if you do too much, you can drop the brow. Same thing over here, little teeny bit. Good. And then laterally, we do, like I said, the edge of the brow, crow's feet area. That will help us get a nice little elevation, which will be perfect for her look. Now, second area we're gonna go to is the forehead or frontalis muscle here. No, I'm good. Raise all the way up. You can see she's got wrinkles across, but again, she's got a short forehead. We're gonna be really careful. So we're just gonna do micro Botox, very small, little bits all the way across. Okay, little baby amounts. Squeeze it, raise up again. Good. Raise up again. Perfect. We just want to soften the lines. And then you also want to go up high, because on her, if you don't, raise up again. Great. If you don't, you're going to be able to see those little ripples at the edge later. Perfect. So just little baby aliquots in the forehead to just soften everything. Now we're going to move on to the crows. And again, remember, we're not much over here because we want to get a nice elevation, but we want to prevent the crows from forming. So smile for me as big as you can. She doesn't have much there, so we're going to go right into the lateral part of the eye. We're going to do just a little big dose, bolus dose right here. You can see the little blood filling up. Some people do multiple injection points, but in someone young like this, you can do one little bleb and just smash it down. Perfect. Go on to the other side. Smile again as big as you can. Perfect, relax, just go right in there. Nice little bleb. And this will do some softening right here and also help elevate the brow, because remember, we're relaxing this whole area because this will kind of travel a little bit, but we're not doing much over here. So that's the final, that's basically the treatment of Botox brow lifting, softening of the forehead and crow's feet. We gotta wait about 10 to 14 days to see the final results.